When I was very young, my aunt was actually a physical therapist. At that time, I thought she was a nurse. She wore the cap and the white uniform, the hose, and the shoes. But she was gone a lot because she traveled, and she worked on the ship Hope with physicians and did physical therapy for children all over the world. And I was so impressed with her. She was like my idol. But also the second story was that I hurt my arm when I was a child. I was a little bit of a tomboy, and I injured my arm, which they thought was broken. My mom took me to the hospital, and we were sitting in the hallway near the emergency room because I was getting an x-ray. And there were all these women going up and down the hall. They had white uniforms and caps, and I asked my mom, what do they do? And she said, they're nurses. They take care of sick people. And at that moment, I remember I was kind of shaking, moving my feet back and forth like little kids do. And I said, I'm going to be one of those. I'm going to be a nurse when I grow up. So that's actually how I ended up getting into nursing. And it was so long ago, I didn't even actually become a nurse until after I had children. My children were 2, 3, and 5 years old before I even went into nursing school. But here I am. Actually, I think I love giving back. You kind of change with the field that you're in, with the part of nursing that you're in initially. When I was in intensive care, I just loved that one-on-one care with the patients, and I think you have this adrenaline rush. And I had the IV tubes and the ventilator tubes and the telemetry monitors and everything. It's kind of like a rush, and knowing that you do a good thing and help families and see them through the hardest times. That was really rewarding. But then I ended up into supervision and becoming a director of nursing. And at that time, then it's like the camaraderie and teamwork with the rest of the team in the whole hospital and doing problem solving, critical thinking. You move to a little bit higher level. Then I became director of nursing here. I mean, who would have thought it? I'd never thought in my life that I'd become a director of nursing. But what I like about being the director of nursing is now everything that you learned along the way, you have the opportunity to give it back. Not only do I give back to the students, because you want them to be the kind of nurse you were, the kind of nurse you want to take care of you when you are in the hospital, and also being a mentor to my faculty so that they can also help those young nurses along the way so that they can become the professionals that we want them to be. I would like to thank nurses everywhere, whatever field area that you're working in. I want all of you to have a wonderful Nurses Week, and for you to always remember that you are blessed, you're loved, and you're needed. Thank you.